the Division of Maternal and Child Health, and I work with injury prevention when there's not a pandemic going on. And Sharon Lee, you're the, I forget your title, you're the school nurse major support person statewide.
Yes, and both Sally and I are public health nurses. I was a registered childcare for 10 years in my home. So I understand the regulations and the paperwork and the meal program and some of that. That's all changed since 100 years ago when I did it. But I've also been a school nurse for 25 years. And so we're excited to be with you. This is you're a great group because you guys are so important. Just a reminder, this is a public meeting as state employees. We have to be aware of that all the time. I don't know that there's any media people present, but if they are, we ask that you identify yourself and give priority to the participants who were here by invitation for questions. In case we run out of time, we want you to know that you can call us. We really encourage you to call us. Our contact information is at the end of the slide. That number with the extension is at the end of these slides. So we're always available. I say always. You can leave your message anytime, and we operate the hotline or warm line from 8 to 3 every day during the week. And Sally will talk later about how we manage weekend coverage for you in case. I had one question, and if folks want to put in the chat box, or excuse me, in the Q&A, I'm interested in how many of you that are on serve also school age children. And if you wanted to put in your in the Q&A box what ages you serve, if you do include school age kids, and then what areas of Vermont are represented in this group in the Q&A. So maybe at some point our great hosts and hostesses will share that information with us. Moving forward, Sally is gonna.
Right. So we always use this slide because it's always appropriate. We always want to say thank you to all the child care providers and early ed programs in the state. And we've said it before, but it always needs repeating. You folks have been on the front lines through the whole pandemic. You didn't shut down like in many states or many organizations. You just kept charging ahead, figuring it out. We offered some advice, but it was mainly advice that we learned from you and took from one provider and gave it to another provider. And you probably know this by now, that all that you learned in doing this on the front line, we like squirreled away here in our little electronic memory banks and spit it out again for the Agency of Education when they were doing their guidance to open the public schools. So we just thank you so much. And you're one of the reasons why we continue, even though it's ticking up a little bit, we continue to have such a low rate in Vermont. And it's because not only you do all these practices in your childcare, but you model it for the families and the community. And as we can get into that, that's what we're finding is going to be really important in the next couple of weeks. So again, thank you.
And based on that, these are hard times. This stuff is damn hard. And if anyone's done childcare, they know what you're doing. Just 2 minutes on, sometimes it gets really hard and it's helpful to reframe the narrative. I'm stealing this from Drs. Feldman and Wilcox from UVM, who adapted their work from Dr. Sood. And these are just 3 little points. This is based in science. And I heard Chris talk about evidence-based. So this is evidence-based. They've studied this. They understand the neurology behind these 3 points. It's not kind of like that airy-fairy stuff of meditation, although I have to admit I do that too. But this you can do on the fly when things are hard. Taking a look around at you, kind intention. What does that mean? That means taking a deep breath and looking at the people that you're with and sending them some good thoughts, sending them some good wishes. Maybe it's a holiday coming up and you want to wish them fun, just in your heart, kind of as a message that you might share emotionally without words. So just having that kind intention, silent good wishes. Let's see. Yep. Kind intentions. So at the end of your workday, how do you relax? How do you refresh your intentions? It's just a way to recharge and think. Maybe you're going to think for a minute. Okay, I need a minute to think about what I'm going to do after work. And then maybe you're going to get a treat. Maybe you're just going to hang out. Another one of the tricks that you can do anytime is when you're planning to meet with somebody, or a parent comes in and you're right in the middle of changing diapers and you can't really stop and have a conversation. You take a deep breath and just focus on what you're doing and realize that they are the person that child, and you finish that child, and then you focus on the parent that just came in, or a coworker that you need to have a conversation with, and just give them full attention on nothing else if you can. And then you'll be able to get back to what you're doing. And then the final little snippet of information was you're planning a meeting that's you might not be looking forward to. Maybe it's some new purchases that have to be made and you don't have the budget for it, or maybe it's just a challenging conversation, one of those critical conversations. And when you before you open the door, before you start the Zoom meeting, before you make that phone call, think about that one person that you're going to meet with, and what is it about them that you're grateful for? Or do you like the color of their eyes, or do you notice something that they're wearing? It's just another way to give your mind a reframe and to think about the positive things that are going on. All right, enough of that. And Sally's going to take over from here on this slide.
And as you get started, I'll just interject. You've got folks on that serve children up to age 12.
Oh, awesome.
Infants, toddlers, and up to age 5, and then a couple up to age 8 or 12. So quite a range.
Great.
And center-based and family childcare based too.
Great. Okay. So from snot to poop to snotty behaviors and wonderful, joyous families, all ages. Thanks.
That's good to know. Thank you. So, jumping right into that, you see the first topic is the strong and healthy start, that the Agency of Education new guidance came out last Friday. So some of those children up to age 12, while they're in school, will be under the guidelines of the AOE, and then will be, having their childcare, their early ed experience with you folks under the childcare guidance, which we've all been using for many months. So the AOE guidance went up. It's officially supposed to start on November 16th, but it's up there now, and the schools are to be working and changing practice and updating their protocols to meet the guidance by that mid-November date. And while they're busy doing that, we are going to be busy working with our leadership to review the childcare guidance, update it, and make sure it's congruent with the AOE guidance. So that's our big task. And then updating all of our materials and public facing documents on the website. So that's what's going on. In all your spare time, you're welcome to read the new Strong and Healthy Start AOE guidance, which is now around 40 pages long. Back to what I was saying earlier, I think some of you could have written the guidance and written the childcare guidance because you are so expert at doing this by now. The first page of the AOE guidance has a great summary of what's new. It's everything from, it's a lot of new, better information that we knew. You kind of have to go through it a little bit before you know what works and how to describe it, and then double checking the latest research, such as research projects like Chris was just noting that she participated in. So it's more on updates on how to do the buses and ventilation in buses, the 3 feet, 6 feet separations, plexiglass, how to use the cafeterias in stage 3. More information on masks, the guidance about health checks, health screenings, and temperature checks. It's a huge effort, and it's really much more clear. And of course, there's some stuff that's still not clear, so it'll never be perfect. The other thing we've put out in the last couple of weeks is those, there's one for how assessing a child's symptoms for return to childcare, and there's one for returning to school. So we hope those are congruent. Again, as you have kids who are preschool or infants, and then school-age children. And then that links to the algorithm to help providers decide, is this okay for this child to return to care or to be tested? So those are all designed to be worked with the medical professionals, pediatricians or nurse practitioners, or whoever the family uses as their healthcare practitioner, or a school nurse. So that's new. And if there's questions about that, when we get into Q&A, we can talk about those a little bit more. We have updated guidance on our website and also the ACCD website about quarantine and travel. And that again is where you folks have been, just great in calling us, because a lot of times when families go out of state and come back, this summer is just like you guys were the stop, that you were where the family had to bring their child. And if they were quarantining and or if they were not quarantining and didn't realize they should have, or did realize they should have and decided they weren't going to, out of the mouths of babes, it was like you were calling us Monday morning saying, hey, so-and-so in my childcare said they all went to Boston over the weekend and the family didn't mention that. And we're saying, well, they should be quarantining. And you're saying, great, I'm going to call the parents right now. So back on the travel updates, you all know about our map, the famous travel map that's on the ACCD website. And if you've been following that, I have a couple of color printouts, and I've seen how in the summer, most of the area around Vermont was green or yellow, and now most of it's yellow and red. And it's, disturbing to see that. But that's what what the governor and our health commissioner is talking about, real concern about. There's very few areas where Vermonters can travel and come back to Vermont and not quarantine. So you folks, again, holding a key role in helping families understand this and know that they should be checking the map before they're making their plans. We can get into this also. We all know about the upcoming holidays and people wanting to travel or wanting to have guests come to Vermont. We can talk a little bit about, you may have been following, I don't know if you have time during your busy days to stop and listen to the governor's press conference at 11 o'clock, but they've been talking a lot about recent outbreaks we've been having in Vermont. Our commissioner was on this morning saying, of course, we're watching these closely. They're concerning, but they're not out of what we would have expected. So they're still, we're not freaking out in Vermont, but we're being very careful. And these would be several schools affected, and the poor folks on the hockey team and the broomball team, they feel like a lot of these outbreaks in the schools are connected to that activity. And the commissioner saying that a lot of that wasn't just so much being together as a team playing the game, but it was, pre-game socializing or carpooling and that sort of thing, which can be, now that we're aware, that can be really put under control, and now the teams are aware. On to the next, we have the border communities and cross-state travel. I'm kind of going into that. So back to the hockey games, they've just put out a lot of guidance now that Vermont teams cannot accept team sports play with teams from out of state, or they can't go out of state. So we're really cocooning here in Vermont with our sports teams. So that's all in ACCD also. And I think
Sally, I'm just doing a time check,
Yep.
so that we probably want to move forward to our other slides.
okay, and then I've hit it a little bit on the border communities and cross-state travel, which you folks are aware of. And when you have questions, you call us often, and it's great. The definitions of essential travel, those I think we've all been talking about for months. And just to note, we have a lot of newer documents for families, and we've been working hard to get them translated. So as you get on to the site looking for things, you'll see that they're translated in several different languages. So that's something else we're working on. As a quick
great.
overview, take it
Yeah.
away.
The other thing about the disease outbreaks is for those who are close contacts in Vermont since the beginning of this pandemic, only 8% of the close contacts have come down with COVID disease. So that's a good thing. I'm not going to get into the details, but these are some fun links, some about how to have fun on the holidays and how to do some good decision making. Dr. Levine says, if your Thanksgiving doesn't look different this year, you might be doing something wrong. So it's all about, it's all about making choices. Are you going to a place where you can be 6 foot apart? Are people wearing masks? Will their places be uncrowded? And there's some great, it's on social media, for those of you who are into that, there's some great kind of talking points. Sometimes it takes a lot of practice to get your words around these concepts. This is scary and new for all of us. So feel free to dig in and use them and practice. So we really are getting to your questions. And Sally, we'll take it away from here. Thank you for sending those questions in, by the way. Really appreciate it. It's helpful.
So if we find out about a positive test result after hours on the weekend, and I'm assuming a common scenario might be, I hope it's not too common, but what might happen is that a family is notified that one of their family members is positive, and they give you a call to help make plans for the Monday morning or something. So yeah, they'll be talking with you if you want to. So what will happen, of course, is as we're notified through the lab results, our contact tracing team is notified of the positive tests and immediately begins working to call the family and do the contact tracing. So we notify, you've heard us say this, we notify well over 90% of the cases within the first 24 hours. We have the best response rate in the country. But sometimes you may find out about it before the health department calls the family. So you're welcome to talk to the family. And if you want guidance, you can call, the number that you call for us, it's at the end of these slides. It's the warm line, but for after hours, it's number 7. So if you just call the number, go on through each number, and if you want to talk to someone that you feel you need to ask about something quickly but also the contact tracers will be in touch too with that. But if it's like, especially if they're calling you on a Sunday morning and you really want to start making some plans. Sharon Lee, does that sound okay with you, or would you?
I think this is the other point of, so if a family member is positive and they're not in your care, you won't hear from them, but maybe your social media will ask. And so that's what Sally's referring to. If somebody is in your care, a child or a staff person, an adult that works with you and with the kids, or is a child, that we will be able to reach out. Sally has collected with Crystal Michaud at CDD a list of all the childcare owners or directors so that we know a point person to reach your program 24/7. So we will be able to reach out to you if we need some additional help for contact tracing, so
Yeah.
that you don't open Monday morning and discover that your staff person was there on Friday and was sick, or the child was sick and positive on Friday, for example.
So, yeah, I hope this isn't getting too confusing. There's a variety of ways that we find out about these positives, and we have a variety of ways to do a stat response between, as they say, Crystal said we can call her anytime, any weekend after hours, to find you folks stat. So we do that.
Then the other question is about telling families of positive results among our group.
Before we go on to that, can I just ask you to elaborate a little bit? I think one of the premises of this question is also if a director or a childcare provider finds out on the weekend that someone has a positive case and
Right.
she's waiting to hear from the health department, should she just go ahead and close her program, or is the program, I think the person who asked is looking for help around weekend decision making. And so
So we're on, Sally or I, one of our team, there's 8 of us. So one of us is on Saturday to help with that process. Dr. Brina Holmes is on usually on Sunday. And when a lab test comes up, or when when you're processing a positive case, one of us will be there with you on the phone.
Oh, great. Thank you.
Yeah. Is that?
So, yeah, but so yes, or if you don't hear from us and you're really concerned and it's concerning, as I say, you can call the EPI line, that main line that you call to get us, or to get an immediate person answering, it's number 7
On the week.
on the weekends. So we kind of, so I don't want to sound like, oh, do this, don't do that kind of thing, but those are the 2 options. Especially because, as I was describing, it might be several hours before the contact tracers find you and start asking you questions, and you want to know what to do. It's very nerve-wracking to sit around all day Saturday waiting for the department to call. So you're welcome to reach out.
So number 7 on the weekends, and number 5 days a week.
Great, thank you.
And telling families about positive results. Sally, did you want to talk about that, or do you want?
So I think a lot of you probably have guidelines about this. It's obviously we need to be careful about sharing the personal health information about families, and it can go from you may not have to tell families anything, because the children, the way the contact tracers have figured out any kind of possible transmission of or potential contacts, it may not be affecting your child care. I'll just say this because sometimes this really does happen. The child or the staff person becomes positive, but because of a day off or a vacation or a weekend, they may not be in the child care when they're infectious. That's why it's so important to have the contact tracers walk you through this, because it's not automatic that you have to shut the whole child care. But then I think a lot of you have guidelines or internal procedures about just if you have to notify people. The contact tracers will help you decide. And then at the most, you might have to say, we've had identified a case in our child care. You can't say if it's a teacher or a student or who, you just say, and as a result, we're taking these actions, kind of a thing. We're closing down, we're closing for 1 day. We've been advised by the health department. And I would think a lot of times this, the people who are positive, unfortunately, in our small, lovely, but sometimes too tight-knit communities in Vermont, the information may be there already, but they don't, just so they're not finding out about who is positive from you folks. And the same with the schools, and the same, we're nurses, we do that. That's part of our training. And I would think too with teachers and social workers, the idea of keeping this type of information private. I don't know if that's detailed enough or if that's too much just talking, and if that answered the question or not. And again, the contact tracers will tell you who is at risk in your childcare, if anybody, and then guidance as to how to message it to your families, or if people from the community ask you. And they do this with the leadership at the pre-K, K through 12 schools too, how to message this. It's so important because we want people to have accurate information, but not confidential information.
So there's two parts to that. The contact tracers do all the exploring. And because you guys are so important, and the same with schools, there is a nurse assigned to you specifically.
That's a good point. Yeah.
Especially if there is a potential for disease transmission in the care in your site. So there's always somebody to follow up with. So this is a great question. It's one of my favorite ones. It finally came around to my language, which, and thinking about what you're doing with kids in your laps and reading stories and working closely one-on-one, or arts and crafts, or playing games and things like that. When kids feel well. So that's just, they're eating well, they're sleeping well, and they're playing well. They're not grumpy. They don't have flushed, they don't look like they have a fever, things like that. So that we can get into the chart and into the weeds a little bit more, but that's really the gray area. Is they have gone home, or they didn't come because they had symptoms. And then they had one symptom and returned in 24 hours, and they acted fine, they ate fine, they slept well, then they're improved. They still might have a runny nose. If they're had two symptoms, then they would need to check in with their medical provider to get clearance. And if the medical provider has cleared them, and again, the child has had 24 hours with no fever, without medication, and they're sleeping well, playing well, and eating well, they are improved. We can talk about the number of runny noses and all that kind of, how many times you have to wipe a nose or Kleenex you have in your pocket, but we can talk about that later. So then I see this one, pediatricians, how are they keeping in the loop of the guidelines? And that is such a great question. We wish that there was this magic wand where you kind of throw the fairy dust and everyone is aware of the new information. Well, many pediatricians in Vermont are taking part in the UVM, University of Vermont VCHIP project. And so they're on with Dr. Brina Holmes and many other infectious disease specialists 3 times a week. And the offices of local health actually do communicate with the pediatricians as well to share some of those tools. But if you're feeling like there's a gap in that, number one, feel free to call us anytime. And then this question is so good because it's actually, Sally and I talked about earlier, it's making us go back to our leadership and say, okay, we know the school liaison public health nurses are communicating with the pediatricians, but what about the childcare? Who is carrying that message between childcare and schools, childcare and medical homes? Obviously, most pediatricians, if they're seeing school-age kids, they're seeing little kids. So we hope that they've had the information. But your local office of local health can help, or you can call the warm line. And I can tell you from example that the, and I'll stop talking, I'll shut up in a minute, that the school liaisons who are doing that for the school nurses and the schools, they have had some great results where they get together with the pediatricians and the family health care providers. So not just pediatricians, but docs that see all ages, family ages to adult, join these meetings with some of the school nurses, and they talk about those tools that are shared, and they work at what's the best way to communicate. And every time that the school liaison public health nurses have done this, the pediatricians in the group are like, wow, this is great. Most of them knew about the tool, but many of them did not. So you're right. All right. So, this one is for you, Sally, I think. Or is this for me? Oh, either.
Yeah, I
What
think
do
we
I-
kind of thought we'd do this.
So what do you do if your kids are homesick and you think they might have a cold? So I'm at home, let's say I'm the childcare provider in my home, and my kids are home from school because they're sick. So maybe I think they just have a cold. Well, if they have one symptom, they can, stay home for 24 hours. But how do you separate them? What did you do before COVID? If you had a family member that was ill, how did you keep them separate from your childcare? If you are, so again, I'm assuming this is a home childcare provider. So it's really about keeping the sick people separate from those that are not well, from those that are well. And then closing for a COVID test. So if you or your child, and you're a home child care provider, needs to have a COVID test, unless you are known to have spent time with somebody with a positive COVID test or travel to a hot zone, you continue what you're doing until the test results come back. So you do not have to close if your child is getting a COVID test, unless they were identified as a close contact. In that case, that would be a different scenario. But so no, you don't have to close until the test results come back. If they come back positive, obviously that moves on. What to do if kids don't want to wear a mask? So we'll go into the next slide, which is kind of fun. This link here, you folks have access to the slides. I think you'll be able to send it out. So this is really great. There's several different ages, but I highlighted the resource link to the 2 to 3 year old. It's really about play. And I remember when the kids were at my house, if there was a new kid coming in, or if we had to do some new safety rules because something had happened, or maybe we have a wading pool and we had a new rule about that. It's about practicing. You're building a culture of, in this case, masks. You're practicing what does it feel like to wear a mask? So maybe today, all the kids who are in age 2 and 3 are just playing with the mask. The next day, they put it on the bear. The next day, they practice wearing it. So it's not about mandating it. They have it on their face every minute of the day the time that they're there. It's about improving their wearing. And then this last question. Oh, go ahead.
Well, it's just like the guidance required or for consideration only.
Yeah.
There's some, as you read through the guidance, and you folks have, I'm sure many times, you can see some areas in there it is required. There's like the masks, the health screens and temperature taking as the children arrive, the cleaning, and then there's some places where it says as much as you're able or as best as you can, or you call us and we say use your judgment. So in that sense, it's we realize there's some gray areas where it's you have to figure it out, be imaginative, and try to do the best you can. And then, of course, everything is the actual regulations. It has to be congruent with the regulations from DCF. So that's a general answer to that. If there's questions you're chatting, and if you have a specific question about the guidance requirements that you're thinking of with this question, you're welcome to type it in or email it to us.
Yeah, we weren't entirely sure what that was behind that question.
Yeah. It's, but everybody kind of looks at that and wonders, because we do call that guidance, not, it is a little different than what you're used to with the DCF regulations.
Chris, did you want to elaborate on that a little bit? I feel like you received that question from a number of providers and you had passed it on.
Yeah, several providers have told me these are recommendations or guidance. They're not mandates. So they've become a little bit lax, and they allow the parents in the home now or in the center. Masks are give or take. Sometimes they're there, sometimes they're not with kids. Grouping of kids or separating kids, same thing. It's getting a lot more relaxed, and they're not doing it as much. So they're reading it off the title, which says guidance, and they're assuming that doesn't mean mandatory.
Right. So I think some of that, I mean, technically that's true, but it's also what our commissioner is telling us, what is the right thing to do. None of us want to get that call from the health department on Saturday morning saying one of your people involved in your childcare has been positive. So we can't let up, and that's where you folks have the hardest job, because you're out there all the time dealing with this, and you have these young kids who require special approaches in getting them to do stuff that helps prevent the spread of this disease. I think also, as we talked about the masking, and we hinted at the governor's concerned about the socializing over the holidays. And I spoke to a couple of childcare providers who say, you know, they do the best they can all day long to keep the kids separate, and they wash their hands and they all wear masks, and then they go home and have a play date with a bunch of other kids, and they're all crumped together on the couch watching TV, and they feel it totally undoes what they've been doing all day. And in one sense it does, but you folks, you know, I'm just going to lay this on you because it's true. You're the leaders in the community, and you're the ones that are going to help us. As I say, there's a bit of an uptick in the in our cases recently. We're worried about that. And the message from the governor and the commissioner today at the press conference was, this doesn't have to go up and up and up. This can be easily, you know, the peak can be right where it is now, and it can start going down, but we need the help of everyone. And that's families and parents, and it's you folks as taking care of our children during the day and being the leaders in the community. So that's kind of my little pep talk, or maybe guilt trip for those of you who have to keep this up every day and be so rigorous. It does get tiring, but that's a bit of a background answer for number 3.
Well, and also I can run back to this other slide here. You folks and the schools, that's why this was made. This whole media campaign, 6-foot spaces, masks on faces, uncrowded places, it was made because you and school teachers and school personnel are saying, look, we are working so hard, and we're on the border, and somebody wants to go hunting next door because that's where they've always hunted, but then they want to come back and send their kid to your care, or they want to go to school. And it's hard. This is not the time to let your guard down, but you guys already know that. And I think we were hearing from you, and we were hearing from schools. And so that's a big reason why this new travel message guidance came out, as to how do we help people make their own decisions. I jumped ahead to did you want to talk more about that? We can talk more.
We have
about
a
that.
number of questions in the Q&A that
All
are
right.
kind of related. I didn't know if you wanted us to jump in with a few of them now.
Sure, go ahead.
Yeah.
So one is, I'm on the border of Vermont and New Hampshire, and care for children from both states. And now Grafton County in New Hampshire is a yellow zone. I'm assuming the families that live in New Hampshire can still attend childcare?
Yes. They have to behave like Vermonters when they come to Vermont. And again, it's that message. It goes back to that public message campaign, is helping them understand that they need to make some choices. If they want to continue to come to care, really, it's up to them to wear masks, keep distance, and make choices about where they go that can be safe.
Yeah. So,
Uh,
yeah.
And
Great, thank you. I keep hearing that there's not been a single case of COVID being transmitted via surfaces. I'm curious if the guidance
is
will be
great.
changing based on this.
Yep, it's already been changed in the school guidance. It's all about that respiratory droplets. And then you heard the new information maybe a month ago about CDC saying airborne. So we wear masks to prevent the heavy droplets from going out and like getting in somebody else's face. And we also wear masks to reduce the amount of airborne stuff that is not so heavy and it stays in the air. It doesn't stay in the air all that long, but when it lands, I mean, I've heard Dr. Fauci and others say, this virus is a little bit of a wimp. It's not that strong. Just because it lives, just because you can find it 3 days on a book in a laboratory, doesn't mean that there's enough of it there to make you sick, or that it's even alive. There may be dead virus that's detectable when they do those testing. So it's really about the direct contact, the airborne virus that has not landed. Once it's landed, hopefully the cleaning and the hand washing will protect us all. Is that getting to the question?
Yes, I think so. Thank you. Chris, did you want to ask a couple questions that popped up?
Sure. The first one is, what is the proper procedure for siblings enrolled? If one child is awaiting COVID-19 testing, should the sibling who is not ill be excluded until the test comes back negative?
Such a great question. You all and the schools are asking the same questions, and it makes sense, right? You think, well, okay, they live in the same room, maybe they sleep in the same bed, so one person is sick, so they're both sick. Well, that's not the way it works, actually. Different people have different immune systems, and so it is safe for the asymptomatic child to come to care. The sick child stays home. If they're waiting a test, they can stay home and wait their test, but the sibling can attend. And the other question that's come in, I know there are, maybe you've run into this, but school nurses have called and said, we've had medical providers tell us that they have, 5 people in a family, 4 of them have exactly the same symptom, and one of the tests came back negative. So I'm assuming they're all negative. That we're not supporting that. Each individual needs to be treated as an individual based on their symptoms and their environment. Did that make sense?
Yes, thank you.
And Dr. Holmes has even reached out and discussed that in those meetings with pediatricians and gotten feedback. And the general consensus is we have enough testing supplies in Vermont. So if there are 4 people in a family of 5 that have COVID-like symptoms, each one should be tested.
Next question says, if we take children who have improved but still have runny noses, aren't we risking everyone coming down with a cold and having to assume that it's COVID? For example, if one gets sick, then I have to close.
So that's where it's so tricky and why you should call us, because every one of those situations is different. The child with the runny nose shouldn't be coming back if they're not better. And if they have a runny nose and it's not better in 24 hours, well, they're probably not going to come back. But if they've been cleared by the pediatrician or a physician or medical provider who has talked to them on the phone or done a telehealth or done a visit, then the provider has done a whole lot of clinical history taking and asked a lot of questions to verify that that child is not at risk for COVID. And as long as they're well, it's okay to come back. But each child or new symptom each new symptom needs to be treated, needs to go home. And each child is assessed differently as a unique individual.
So I've heard some discussions
Okay.
from folks in programs around clear runny noses or, not clear, and, if it's just from teething and it's clear, we let them stay. So and I know this is another one of those gray areas that we've been talking about, but can you talk about that a little bit? I think that's on the mind of programs around sending home with the runny nose, letting them back with the runny nose, and knowing that children in Vermont have runny noses from September through June.
Yep. My nose ran. I learned to blow my nose before I learned to walk because I always had a runny nose. So I love this question because snot can come in any color, and if it's not blood, it's okay. If it's clear, it just what the color of the runny nose, the mucus is, it's an indicator of the phase of the condition, not an indicator of contagiousness. The clear runny nose was language used early on because a lot of the guidance was started as we were getting into the allergy season. And typically allergies are more just plain clear runny noses. In the cold weather, as soon as it got cold, kids, there's a funny name for it, vasomotor rhinitis. When you go outside, your nose runs. It's the thing in my family. My dad, eyes runs, his nose runs, and when he comes in, it's gone. So there's things like that when you might think of color or discoloration. And teething, interestingly, and Sally can correct me, but I think I keep hearing Brina Holmes kind of scratches her head and says, teething isn't really something that we see in pediatrics as causing runny noses. So she was trying to separate it from that. But that if a child, its mouth is really sore and they're uncomfortable, they might be just more weepy and drippy from that. So call. That's what the warm line is for. It was specifically started to be a direct contact for childcare providers in those 5 days a week.
Thank you.
Yeah. This link here is very specific to helping little kids get used to masks. And one of the other things I wanted to remind people about helping kids practice learning to wear a mask was it's about modeling. The more they see other people wearing masks, the more it's going to be a commonplace thing to do. My grandchildren, the youngest that's wearing a mask is 3. And, she's doing it just fine. Once in a while, she'll get in a mood and she'll take it off, and I just move away, and she eventually puts it back on, and we come back together and do our thing. You don't always have that freedom when you're managing several kids at a time. I understand that. But it's about your modeling. You can do things like coloring pictures or coloring a paper mask that they can make their own, and show them characters and cartoons, folks that are wearing masks. So it's just kind of building that culture.
To build on your mask question, there's a comment, a comment and a question. Some providers are not wearing masks since it's guidance, not required. And will the updated guidance require mask wearing for ages 2 and up in care instead of recommending? So just general comments, questions about mask wearing.
Yeah, so it's a recommendation for young children. And as it's actually a requirement to practice, so to move towards wearing them. The requirement is for adults must wear masks. If they're unable to wear a mask or face cover in childcare, they might need to move to a position that doesn't involve direct care with kids.
So it is
So-
required.
Well, yes, yep.
Yeah, for 2 and up, yeah.
Mhm. But
And
again, you're not forcing the little ones to do it all, helping them learn.
The next question here says, if a sibling gets a positive test result, should the sibling who wasn't tested remain excluded to isolate, or should the sibling also be tested before returning to care?
So that's a great question for the family's medical provider. The one who is tested and is positive means that the sibling won't be in your care for, so their quarantine is 14 days from the time that their sibling is positive. So they could test out if their sibling, depending on the timing. And these are really hard. I wish it's one of those wishing I had a magic wand. And this thing doesn't really work very well, but I try really hard. But every one of those situations is different. So the answer is, it's possible to test out at day 7 with a negative test, but it depends on the situation.
Yeah,
So-
and that's where if we are getting positives,
Yeah.
the contact tracers walk the family
Right.
through who should
And
get tested and quarantine and all.
And again, because it's a direct, if so a child in your care who's positive, that means you will have a public health nurse specifically assigned to help walk you through that too, in addition to the contact tracer.
We have a couple minutes left, and there's one more in the Q&A. And then I was just going to make a quick announcement that if anyone else had 1 or 2 more questions, to put them in now, and I think we have a moment. But this last question is mostly about compliance and how is the mask wearing of the providers being enforced? Frustrating that I wear mine, but others are not. And I wonder if the sort of your answer is best practice if you know of when it's not happening. Is that something for the licensors? Is that something for the health department nurse, the warm line? Where would you go with that issue if you were in the field?
Sally is so diplomatic. I'm gonna let Sally
Oh,
do
thanks.
this one.
Well, I mean, yeah, call us and we can talk you through that or talk through about that. It depends. There is, we can recommend that you call the licensor and report this. But again, yeah, just an acknowledgement that it's hard. I think in Vermont, we've taken the approach of trying to be non-punitive as much as possible, that type of thing. But again, in this situation, you all are working under regulations. And so, yeah, there might be times when it's appropriate to call the DCF licensor and say, this is what I'm hearing, and they will call. So, so several options.
We have talked to folks through that. You know, and Brina is so wonderful about talking about this is a team sport. And sports aren't always just fun. This is a hard time, but it takes a real team effort to get through these things. But she talks about it as a team effort in that it means working with the childcare director or talking with your colleagues, finding fun ways to have those hard conversations, and use the chain of command. That's kind of what emergency response is for any of you that are already EMTs on your spare time, or first responders. There's an incident command. Use your chain of command. That's like bureaucracy, but that is what we have to do to work with our leadership. And when all else fails, there is a process. It's actually on the CDD website where you can make a report that way.
Yeah.
So
Or,
we want to do it as in partnership in a strength-based manner because we know this is really hard.
or that person can call us too, if you're having a conversation and they're saying, I am just not getting this, how I can do this mask thing, and say, well, call the health department, they'll walk you through it.
Mhm.
So variety, a soft response, but at a certain point, this has to happen, so.
We are close to time, and I know that we've got 2 more sessions of this scheduled that we've got on a slide, so but I'll quickly read these last couple
Oh.
ones and see if you can address them
Yep.
in a short manner, and if not, we can maybe put them on to the next session.
Yep.
Is it likely the teachers would need to be tested when an enrolled child or enrolled siblings has tested positive?
So if the child is in care and has tested positive, then the teacher would have to quarantine if they are identified as a close contact. So if the child was in the other room and the teacher wasn't working with them, no, that teacher wouldn't have to quarantine, but just the close contact.
Yeah, that's really helpful. Is there anything in writing that specifically says 2, 3, 4-year-olds in-home childcare required to learn how to wear masks? I have parents that do
Oh.
not want the child to wear a mask, so not certain how to handle this. It sounds like you did answer that one with
Yeah.
practicing. There,
Yeah.
Yeah,
That's a game.
yeah. And then
And-
the last one, what is there a date for updated childcare guidance around this to come out?
This thing is not working very well. We don't have any magic crystal balls either. So
I think-
maybe I'll put my hat and my broom on and try to find one, but go ahead, Sally.
well, I was just saying, now that the AOE guidance is out,
Right.
well, we are starting. So I
Yeah.
don't know, that might be a couple of weeks though, before we see anything, you
Yeah.
know, splashed across the website. And in the meantime, give us a call, and that's one way we can collect some information to get back to the process for revising. And Brina is working with the pediatric infectious disease pediatricians and others to inform an updated guidance.
Some of you may know that Dr. Holmes has moved to a different job. And I think we all adore her and her warmth and her leadership. But she continues to be available to us 40% of the time, while she's now 60% of the time with the VCHIP program at UVM, the University of Vermont. So anyway.
Mhm.
Thank you. So thank you so much, Sharon Lee and Sally. This was great. And
You guys are fun.
we have, as I said, I think on the next slide, we might have the links to the upcoming 2 sessions.
Yep,
On
there you go.
November 19th and December 10th. Those are during the day from 1 to 2, hopefully nap time for those of you who are with children. These are, we will send out the PowerPoint so that you will have these links through the PowerPoint, and also they're on the events page at Let's Grow Kids. Yeah, we hope to see you then if you have additional questions. And again, thank you all for joining us tonight, and thank you to you folks from the health department for helping us out.
And thank you for taking care of the next generation of Vermonters.
Good night, everybody.
Good night. Thank you all.
Good night, thanks a lot.
Thank you, Luann and Marie and Chris. Chris, did you see that slide with the hunting?
Yes.
So was it you or your son who had got somebody was talking to you at a phone meeting, and you mentioned somebody was hunting? Was it
Yes,
you?
yes, my
Yeah.
daughter.
Yeah.
No, not me, my daughter.
Yeah. Yeah, well, that's why the hunting scene was on that slide. I thought of you.
Yeah.
It makes perfect sense.
Some people need to do that.
That's right.
Yeah. And now
Chris,
we're
I
just
wanted
trying to,
to ask you, is there a write-up or any kind of pre-publication summary of the Hopkins research that you were describing?
oh, I love
Yeah.
that
Yes,
term.
there is. I'll send the link.
Yeah.
I'll send the link to our email.
Yeah.
And I believe there's also, those of us that participated were able to go to a Zoom conference.
Mhm.
And so that was recorded, and I believe that's out now too, that recorded information. So it's in writing and also in
Yeah.
video form.
So I would assume Brina and her pediatric ID physicians will get wind of this and know about it,
Yeah.
but we'll make sure she knows. And that sounds just incredibly interesting to have been able to do that. I'm glad you shared about that.
One interesting thing about it, they collected so much data. They wanted specific answers to questions like what was the best practice and what was working. But they've got so much data, they're actually, now they're saying, what else do you want to know? Because we have all this stuff.
Yeah.
So they're going to continue using what they gained and also the group that they use to expand their research further.
Yeah.
So it was very interesting.
Yeah. That'll be great. Yeah, I'd
Thank
love
you,
to. I'd
folks.
love to
I'm
see
gonna
that.
end this.
Yeah,
so we
thank
can
you.
go on
I
to
have
our
to go.
evening, and we'll
Have
be
to
in
go
touch.
eat.
Yes, and we'll be in touch before the next,
Thank you,
the next
Luann.
session. Thank you
Thank you all.
Bye-bye.
Bye.